Good morning, everybody. We're going to get started. So happy to have you all, and welcome to the 2025 Wisconsin Enrollment Conference. So we have nearly 350 registrants. We might actually have 350 at this point. We're very close, which is just fantastic. And those registrants represent at least 123 organizations around the state. I believe we also may have a record for the number of people who signed up for pre-licensing this year, which is excellent to hear. We're always looking to help support more capacity in the state for enrollment assisters. So I'm Allison Espeseth. I'm the director of Covering Wisconsin. This is our 13th year hosting the conference. And it's also our 12th year being federally certified navigators in the state. So let me just tell you a little bit about Covering Wisconsin, a little bit about navigators, especially for those of you who are new. So navigators, alongside other enrollment assisters like certified application counselors, agents, and brokers, do help with direct application and enrollment assistance with both Medicaid and Marketplace. The navigator role is also a great deal more. So navigators are very outward facing, actively pursuing all the ways that they can help raise awareness with anybody, both consumers and other professionals, about the healthcare options and processes that govern them. So we try to connect with, and at times tie together, the innumerable constituencies in our state who have a role and affect the health insurance and healthcare experience. So that includes all of you, and which is why we host this conference. So federal funding for navigator programs has been cut by 90% this year, which for a period of time made it unclear if this conference was going to be able to happen. It's been a priority to make sure that Covering Wisconsin is still here and that navigators still exist. And it was quickly clear to lots of folks who wanted this conference to keep it going as well. And we're happy to do so. So this results in large part to the support of the Covering Wisconsin team and navigators everywhere. They help to inform the content of this conference and really to help make sure what we're providing today and tomorrow and Wednesday is really the latest information that you need to hear. So I wanted to give all of them a huge, huge thank you. But of course, we didn't do it alone. And every part of this conference was also made possible by the active and dedicated engagement of the steering committee, and especially Wisconsin's Department of Health Services and Office of the Commissioner of Insurance. So again, a huge, huge thank you to both of those agencies and our steering committee. And as you saw, we have numerous very generous sponsors who lend financial support to this work to make it possible to do the conference, to do everything behind the scenes. So specifically UW Health, Common Ground Healthcare Cooperative and Care Source, Aspirus Network, United Healthcare, Network Health, Security Health, Dean Health Plan by Medica, GHC of South Central Wisconsin, and the Wisconsin Hospital Association. And finally, a big, big thank you to all of the speakers who have generously offered their time and expertise. I do want to give a big shout out also to a few folks who are behind the scenes. Covering Wisconsin's Helena Gilbertson and Elizabeth Rothy. This is not their only job, but they put in just so many hours and so much dedication to just making this possible. So thank you both. So finally, thank you all for being here. This is a big investment of you, and we are so appreciative, and the people of Wisconsin really benefit. A few reminders before we get started with our first session. Please do use the Q&A function to ask questions. That will help to just make sure we see those questions and can answer them. Between each session, we will have a 10-minute break. And just stick around, make sure that you go through the full day because we will have a gift card drawing at the end of the day for those who are in attendance. We'll also post a link to our evaluation after the second session. And that way you can give your feedback as quickly as you can at the end of the day for those day sessions. So with that, I'm going to pivot to our opening plenary. And I'm so pleased to get us started and introduce our guest moderator, Scott Stewart, who will in turn introduce our two speakers. So Scott is currently the CEO for the Wisconsin Primary Healthcare Association, the statewide association advancing the cause of the 19 community health centers in Wisconsin. He has over 10 years of experience making significant contributions to community health centers, nonprofits, and initiatives focused on health and wellness. Most recently, he served as the Chief Strategy Officer at Honor Community Health, an FQHC in Oakland County, Michigan. And previous to that, he was the Vice President of Programs for the Pontiac Community Foundation. Scott is currently a board member for the Michigan Nonprofit Association and serves on the Leadership Council of the Milwaukee Healthcare Leadership. Let me welcome to the stage Scott Stewart.
Awesome. Thank you, Allison, and really grateful to be here and having a really important conversation at a really important time with many of the folks here. And so I will go ahead and get started. And at first, of course, welcome dear Becky to the stage. And so Becky Easland is the Deputy Commissioner of Insurance at OCI. As the Deputy Commissioner, Becky is responsible for the overall operations of OCI and actively participates in all NAIC activities and engagement with stakeholders. Before OCI, Deputy Commissioner Easland served as the Senior Policy Advisor with the International Association of Insurance Supervisors, and during her time with IAIS, she assisted in the development of the Global Insurance Capital Standard, worked with the Macro-Prudential Community, and provided project management support to the Policy Development Committee. Prior to joining that, she worked at OCI for over 15 years as a financial examiner and the director of the Financial Analysis and Examination Bureau. And so we will turn it over to Becky to get us started with her presentation.
Good morning. I'm not sure if my video is playing yet.
Not yet, Becky.
Okay.
It looks like it's off.
I don't seem to have control over that. Anyway, thank you for the introduction, Scott. The Office of the Commissioner of Insurance is committed to fulfilling our mission of protecting Wisconsin consumers by maintaining a strong insurance industry. Oh, maybe I can do it now. There we go. Expanding access to quality, affordable health insurance coverage has been a priority for Governor Evers since day one. And next slide, please. Last year, a record-setting 313,579 Wisconsinites were covered through the ACA marketplace on healthcare.gov, which was an 18% increase from the previous period. Our recent enrollment increases have been supported by previous federal funding for navigators and outreach, as well as the enhanced premium tax credits that made premiums more affordable for nearly 90% of Wisconsin enrollees. Since its enactment, the ACA has also made it easier for everyone to get the high-quality, affordable health insurance they need. ACA-compliant plans on healthcare.gov are guaranteed to cover essential health benefits, including hospitalizations, mental health, and substance use disorder services, pediatric care, and pregnancy, maternity, and newborn care. Wisconsin's number of uninsured dropped by around 200,000 since 2013, when the ACA provisions went into effect. Under the ACA, the 1332 state innovation waivers allow states to pursue innovative strategies for providing residents with access to high-quality, affordable health insurance while retaining the important protections of the ACA. Since 2019, Wisconsin's Office of the Commissioner of Insurance has operated the Wisconsin Healthcare Stability Plan, otherwise known as WISP, under a 1332 waiver. WISP is a bipartisan effort that has helped hold down rates every year since its implementation, and it's federal and state funded up to $265 million per year. WISP reinsures the highest cost claims for insurers on the individual market, so that they can reduce the impact of these expensive outliers and hold rates down for all policyholders. WISP also helps Wisconsin remain an attractive market for insurers, which is why we have one of the most competitive markets in the country. Rates on healthcare.gov would have increased by approximately 19.5% for the 2025 plan year based on a weighted average, but WISP cut that increase down to a weighted average of 8.2% for the 2025 plan year. And just to look at prior years, in 2022, rates were 14.5% lower, and 23, 13.7% lower than they would have been without WISP. Unfortunately, the federal reconciliation bill and provisions in the marketplace integrity rule rolls back previously successful policies and creates new barriers to healthcare access for Wisconsinites. The marketplace integrity rule eliminates the year-round opportunity for the lowest income individuals to apply for coverage, increases the maximum out-of-pocket costs for consumers, shortens the open enrollment period, and rescinds eligibility for deferred action for childhood arrivals, DACA recipients. The Congressional Budget Office estimated that the number of uninsured people in this country will grow by 16 million as a result of the federal changes to healthcare access and affordability. That's 4.2 million people will lose coverage due to expiring enhanced tax credits. 10.4 million people will lose coverage due to the reconciliation bill, and 1 to 2 million people will lose coverage more due to the marketplace integrity rule. Marketplace enrollment is estimated to drop by 10 million people nationally. An Urban Institute report estimates that 52,000 Wisconsinites will lose marketplace coverage as a result. Last year, the Center on Budget and Policy Priorities calculated how costs may change with expiration of the enhanced premium tax credits and found that older enrollees will likely be the most impacted. In Wisconsin, the average 60-year-old couple making $82,000 may see their annual premium costs increase from around $7,000 with subsidies to around $25,000 without. This is an annual increased cost of around $18,000. Enrollment is expected to decline across all income categories without the enhanced premium tax credits in place and with extra hoops to jump through because of the program integrity rule, with the youngest and the healthiest enrollees most likely to choose to go without health insurance coverage. The new marketplace integrity rule also makes it more difficult to remove agents from the marketplace that aren't acting in the consumer's best interests and allows these agents to continue operating. And we can move to the next slide, please. OCI is here to make sure that consumers are educated about their options and know how to avoid the bad actors who may try to sell them health coverage products that are not ACA compliant, unregulated, and even scams. But our ability to take action against agents is inappropriately limited without the cooperation from Medicare and Medicaid Services, or CMS. Wisconsinians should be cautious if they receive unsolicited sales calls, texts, or emails from individuals offering to sell health insurance over the phone. Out-of-state agents and brokers are using sophisticated marketing tools on social media to access personal information and enroll consumers in coverage without their full knowledge or understanding. And the new marketplace integrity rule will make it harder to keep these agents from selling health insurance on the marketplace. Consumers should avoid entering their personal information into a Facebook or other social media platform. Consumers should verify the legitimacy of the individual they are communicating with by asking, are you a Wisconsin licensed health insurance agent or broker? Are you a Wisconsin licensed navigator or certified application counselor? Are you offering ACA compliant qualified health plans? And am I eligible for Medicaid or Badger Care? Wisconsin consumers can search companies, agents, and navigators with our lookup portal on oci.wi.gov to confirm the company or agent offering insurance is legitimate and licensed to sell insurance in our state. Governor Evers' DHS and OCI healthcare coverage partnership has created a trusted enrollment information resource with covered.com, where consumers can learn about their options and find out how to get enrollment assistance in English, Spanish, and Hmong. And we will continue to keep the site updated throughout the open enrollment period. There is no doubt that this will be a challenging open enrollment period with higher prices for consumers, a greater administrative burden for those trying to access coverage and subsidies, and misleading marketing and enrollment tactics for consumers to navigate. Consumers may need to consider alternate healthcare coverage options because they realistically cannot afford or are barred from accessing comprehensive health insurance coverage on healthcare.gov. With that said, I appreciate your time and continued work to get Wisconsinites covered, especially in such an uncertain time for healthcare access. And with that said, I will turn it back to you, Scott.
Thank you so much, Becky, and appreciate the background on everything that OCI is doing in this moment. I know that we have a poll, I believe, that will be coming up now.
Yeah, Mike, can you put that polling question up? And so,
Awesome.
yeah, we're gonna flip it a little bit. This one is a little bit more, but it's a good introduction to our next speaker. So this is focused more on, well, actually, it's a little bit of both. So in 2025, I've had consumers enrolled in a plan without their authorization. And so this is more of a just getting a sense of what you guys are seeing. So A is yes regularly, B is yes sometimes, C is no, not anymore, and D, no, never. And so we'll give folks maybe 20 seconds to finish up that vote, and then we'll share what people are seeing in the field, and then we can move forward with our next speaker. So maybe just 10 more seconds. All right, Mike, do you want to go ahead and share that? Okay. So it's all over the map, and most of it, folks, are no, never, but we are definitely seeing some yeses in there, maybe actually about even with the no. All right, thank you. I'll hand it back to you, Scott.
Thank you, Allison. And concerning to see the yeses, especially the ones that are saying that it's happening regularly. So I'll be excited to get into that with Becky as we get to the panel. And so want to highlight and say hello to Bill Hanna and have him move into his piece here. So Bill was appointed as Wisconsin's Medicaid Director in January 2024. Most recently, Bill served as Wisconsin's Deputy Medicaid Director and has 15 years of Medicaid experience at both the state and local levels, including previous work at the Wisconsin Department of Health Services, Dane County and Portage County Human Service Agencies, and the DC Department of Healthcare Finance. Bill was a regional director of growth and strategy at United Healthcare, supporting Medicaid HMOs in Virginia, Maryland, North Carolina, and Florida. And he holds a Master's of Public Administration from the University of Georgia and Bachelor of Arts degree in Government from Lawrence University. Bill, I will tap it on to you to give us the fun updates on Medicaid and all those nice things.
Thanks, Scott, and thanks everybody for joining today. There's a lot going on in the Medicaid space. It was a very busy summer, both at the federal level and at the state level, with HR 1 or OB3 or OBBBA. It has many names, but clearly got a lot of attention, both in the press and certainly at the Department of Health Services. There were a lot of provisions related to Medicaid in HR 1. I'm going to focus on just two related to eligibility. There were a lot of financial changes included in the bill, but thanks to Governor Evers' leadership, you may have seen Wisconsin passed its state budget just the day before HR 1 became law, securing over $1 billion a year in additional federal funds. Many of those changes, the reason we had to ensure that that bill was signed before the federal bill, so that Wisconsin could be grandfathered into many of those changes that were effective July 4th related to Medicaid financing and securing really the financial future of Medicaid. Wisconsin is in a good place financially to support our Medicaid beneficiaries and continue the program as is, not unlike some other states who are seeing some real financial difficulties as a result of the federal bill and the financing changes. But more specifically for this conference for you, I want to focus on two specific provisions in the bill that will impact eligibility in the future. The first is, many of you are aware, currently somebody enrolling in Medicaid can look back 3 months, often called retro eligibility. So they may have incurred a medical claim, they may have ended up in the hospital, may have ended up in a nursing home and didn't expect to, and they may not have had Medicaid at the time they entered. Today, we can go back 3 months and see if they were eligible during those months, and if so, Medicaid can cover those medical costs in that retro period. That period is shrinking to 2 months going forward. The second, and probably the bigger change that's gotten most of the conversation, is specific to the childless adult population in our Badger Care Plus program, called community engagement in the federal bill, but more commonly, we're talking about work requirements that will go into effect. Both of these policies will go into place no sooner than January 1st of 2027, as that was written into the federal bill. We estimate that the change in the work requirements, or the need to prove that people are meeting the work requirements as spelled out in the bill, will impact about 63,000 childless adults in Wisconsin. I want to clarify a few things. As you know, Wisconsin is a non-expansion state. Many provisions in the federal bill differentiate policies for expansion states and non-expansion states. For most provisions in the bill, Wisconsin is a non-expansion state. The one clear exception is around work requirements, because the bill focuses the policy on not only expansion states, but states that have covered similar populations via a waiver. And that's how Wisconsin covers childless adults up to 100% of the federal poverty level. And so that work requirement provision, while it doesn't apply to most non-expansion states, it does apply to childless adults in Wisconsin. What folks will need to prove in order to maintain their eligibility is that they are working not less than 80 hours in a month, or providing not less than 80 hours of community service or volunteer work, or enrolled at least half-time in an educational program, or participating in not less than 80 hours of a work program, or some combination of those three in order to maintain their eligibility. There are a few exemptions of folks who do not need to meet what I laid out, those 80-hour criteria. That includes enrolled tribal members do not need to meet those eligibility, those work requirements. Veterans with a disability status, individuals who are medically frail or otherwise has a special medical needs, Those are not defined clearly in the bill, and this will be what we are working on over the next 12 to 18 months with CMS on defining who exactly qualifies as medically frail or otherwise has a special medical condition and therefore exempts them from meeting the work requirements. Also, if an individual is meeting the food share or SNAP work requirements, they are considered meeting the work requirements for Medicaid purposes. And I want to talk just briefly, I know this is a Medicaid enrollment conference, but there were also significant changes to the SNAP program or the food share program, as we call it in Wisconsin. There are work requirements today for SNAP, but the federal bill expanded who must meet those work requirements. It now goes up to age 64 or through age 64, where it was previously through age 54. And previously, if you had a child under 18 in your household, you were not required to meet the work requirements. That age number has now dropped to, if you have a child under 14, you are not. So it has expanded the number of individuals that will need to meet work requirements to maintain their food share benefits. One way to meet that is to enroll in our food share employment and training program called EFSET. The SNAP provisions are effective immediately, unlike the Medicaid provisions. And so we are working hard to expand our EFSET program for increased enrollment to meet the SNAP requirements. And so I would encourage you to, over the next year, familiarize yourself with our EFSET program, as that will certainly be a means to help individuals maintain their Medicaid benefits once these provisions go live in January 1st of 2027. So I want to circle back to that date of January 1st, 2027. The bill, as written, allowed the Secretary of HHS to give states good faith waivers if they are making progress towards implementing the work requirements. Early last month, CMS came out and articulated that they do not intend to provide any, perhaps one or two, in rare occasions, waivers to extend the deadline to meet work requirements. So we are working hard to meet that January 1st, 2027 deadline. There are a lot of policy details that are still unknown, and CMS is not required to release guidance until June of 2026. We're not waiting. We're not waiting for that guidance. That would not give us enough time to implement the policy changes and communicate to members the impact. And so we are working right now and at CMS's suggestion, making assumptions about what will and will not count as exemptions, what documentation will and will not count to prove that you are meeting the work requirements, and building both our communication plan and our system modifications to be ready for January 1st, 2027. So what can you do right now? Because we know there's lots of angst, lots of anxiety, lots of talk about changes coming, and people want to know what they can do. So what I would ask of you, if you are getting these questions, is first to remind folks that they have not lost their healthcare coverage today. The changes are not in effect today. They will not be in effect in 2026. This may sound familiar for those of you who were with us for unwinding. The most important thing individuals can do today is make sure that their contact information is up to date with the Department of Health Services. So that means going to the Access website or using the My Access smartphone app. And some of the tools we built during unwinding to include text messaging, email communication, rather than the old school paper letters that get lost or take too long to get to people. And so encourage folks when they are in the Access website or the My Access smartphone app to please sign up for text messaging. That way we can target communication to the individuals most impacted by these changes once the policy becomes clear, with clear actions on what they need to do in order to maintain their eligibility. We've also set up a web page that we will continue to update as new information becomes available. It's called the Medicaid and Food Share Partner Resources page, Federal Changes. We've set up similar pages during unwinding. This is going to be the go-to information for the evolving policy space that comes with these changes. Thank you, Maciel. Just put that in the chat so you have a link to that. Third and finally, we will continue to engage our partners, including Covering Wisconsin, over the next 18 months. The feedback we get from you all via Covering Wisconsin and other organizations is critical to make sure that individuals are understanding the information that we are putting out, that we are clarifying new policies. Inevitably, when changes this complex happen, it's bumpy. And so I really want your feedback as we roll into the end of 2026 and early 2027. We at the department will be ready to pivot and adjust to make sure that members are not unnecessarily losing their Medicaid coverage. So I'll end here. I know there's a couple questions that Scott will be facilitating, but want to thank you again. Your partnership now is more important than ever as we navigate these changes over the coming months.
Thank you very much, Bill, for covering. And I figured you'd add SNAP in there as well, because I know you're dealing with all the fallouts on that end. But hold on one second. Sorry, seems like I might have frozen a little bit. There we go. Okay. I know we have another poll that we were adding in here, so
Yeah, we can lift up that
hold on one
poll,
second.
Mike, if you want to add that.
Okay, there we go.
And certainly as we're bringing that up, please don't continue to put questions in the Q&A. And so this one, I swear it was not intended as a test your knowledge, though this was something that Becky had mentioned also in her remarks. It's just a question about how many Wisconsin residents enrolled in healthcare.gov marketplace plans lost open enrollment. So that would be for this plan year, 2025. So A is 221,128, B is 266,327, and C is 313,579. So we'll give you just a couple more seconds here to select which one, and we'll see what folks think. All right, Mike, why don't you go ahead and share those responses? All right, yeah, that's right. C is correct, 313,000, which was a record year. So great. All right, I'll hand it back to Scott.
I know we will add Becky back and get our panel discussion with questions started. So you can pop back on camera, Becky, that'd be great. Perfect. So now you should be seeing all three of us. And so but I would, I'll probably bounce back and forth between both of you, and then we'll do some audience questions at the end. But Bill, since you just finished speaking, I think you spoke a little bit around, Wisconsin being a unique state for a lot of different things. And so, you mentioned a little bit around the waiver and all of that piece. And so I think, one of the things I've been noticing on the ground is I think we're going to face a lot of challenges, right, with what that means in terms of communicating with folks. And so I was just curious, how might, adding a little bit more into what those new requirements might look like a little bit differently in our state, and how we make sure that we're messaging appropriately. Including things like even 6-month enrollments, right? Could you maybe cover a little bit on that end?
Yeah, it's a unique challenge in Wisconsin. There's no state like Wisconsin because we are a non-expansion state who then also has a waiver. Like I said, and I will try to repeat this, it's confusing. For most provisions, we're a non-expansion state. So when you read national coverage, or you look at national organizations talking about the difference between expansion and non-expansion states read Wisconsin as, for the most part, as if it's a non-expansion state. And I know we try to communicate with national partners to make sure they understand the nuance of Wisconsin. So specifically, work requirements, yes, does apply in Wisconsin. A couple details in there, however, when you read the national coverage of work requirements, it includes childless adults, and for other expansion states, it includes people with children over the age of 14, not in Wisconsin. That does not apply in Wisconsin because we do not cover that population the same way that an expansion state would. So when I say childless adults in Badger Care Plus in Wisconsin, that is very specific to Wisconsin. Scott also brought up the federal bill requires 6-month eligibility renewals for expansion populations, not in Wisconsin. Again, because we are not an expansion state, we cover that population via a waiver. And so this gets really wonky and technical looking at how the Social Security Act is written and how the federal bill was written, but does not apply to Wisconsin, again, because we cover our population via our Badger Care Plus waiver. There are also cost sharing requirements for childless adult populations. That applies to individuals above 100% of the federal poverty level. And since we don't cover above 100% of the federal poverty level, also do not apply in Wisconsin. So it's a little confusing. Again, the biggest takeaway is work requirements, yes, really for the childless adult population. Most of the other eligibility nuance related to the childless adult population or the expansion population does not apply in Wisconsin.
Thank you, Bill. Yes, I think that, I do a lot of looking at our national partners like KFF Health, and every time I look at it, I'm like, well, that's not 100%, right? And I'm like, dang it. So thank you for the clarity on that piece. Becky, I wanted to maybe go over to you real quick and talk a little bit. I know you talked quite a bit around, how we can help you with kind of some of the fraud and other things we're seeing. Maybe I wanted to spend a little bit of time just kind of seeing or hearing from you what are the latest findings and initiatives you kind of are hearing about within Marketplace. We talked around people, having a lot of folks being enrolled pretty regularly and some plans that they did not plan that they did not choose. And so would love to hear a little bit around, both what the department is doing further to address that and how we can help. And then also, are there other things you're seeing as fraudulent in the marketplace?
Yes, and thank you. So, a big thing is continuing. So earlier this year, CMS rescinded the terminations of thousands of agents who have been removed from the marketplace due to unauthorized enrollments or other inappropriate actions. Those agents now have access to the marketplace again, and we are getting little information from CMS about how future investigations will be conducted when allegations are made against agents and whether they will engage with states in a transparent manner. The new marketplace integrity rule also creates a greater administrative burden to remove agents from the marketplace that aren't acting in consumers' best interests. CACs and navigators can help consumers recognize red flags and marketing tactics to avoid unsolicited sales contacts trying to enroll them in coverage that may be unsuitable for them. So sisters can also help us spread the word to consumers that they should avoid entering their personal information, in Facebook and other social media forum or responding to other unsolicited sales contacts.
Appreciate that, Becky. We'll go back to Bill. And so I think, you spoke a little bit, Bill, around, applying lessons learned and new systems and innovations from unwinding. Just wanted to kind of maybe harp on that a little bit. Like what else, what did the department learn during that process? That was our probably most extensive process in many years in terms of having to re-enroll folks. And so, what other things, might be important to pop out from that initiative?
Yeah, I think I want to highlight one difference, right? Unwinding, we knew was coming. We had a
Right.
long runway to prepare for unwinding. Unfortunately, because CMS has indicated that they will not grant any extensions, we're not going to have quite as much of a runway as we wanted, especially with CMS not publishing final guidance likely until next summer, which gives us a really short window to make sure that all that is communicated. Nonetheless, I think the biggest piece that we saw was clearly the engagement from individuals via, again, our text messaging campaigns. We can see the open rate of those and the received rate and then the dropout rate. When you look at that compared to the returned mail we get, we really want to lean into the text messaging engagement. Obviously, folks, if they can keep their phone, then their address is less important. People move, but often keep the same phone number, or at least keep their same access account, even if their phone number changes, and so can get messages online. We saw that as a tremendous strength during the unwinding. And I think, as I said before, also engaging with community members, folks like you all, assisters, on that feedback. We want to work with you before the policy goes live, because if you don't understand what we're saying, there's no way our members are going to understand what we're saying. And us at the department, we can sort of get lost in our own speak. We work on this every day and sometimes don't speak sort of normal people English. And so getting that feedback from you all early is important, because this is complex information to communicate, but it's critical information. And so we do plan to stand up some of the similar work groups we had during the unwinding phase.
Great, thank you, Bill. And obviously, I think both the department's own text messaging, but then also, many of us are community organizations or have our own access and communications channels. So, however much we can always, combine those efforts together is really important, right?
That's a good point, Scott. One piece we did is we built a lot of partner toolkits during the unwinding. We will be looking to build something similar, right? So we can build some of those digital assets that then anybody can use to share via your social channels. In government, we're a little bit limited in our ability to use some of those channels, but if we can give you the same messaging and we build that echo chamber so that they see it over and over and over again, that is definitely, we also saw as a success, both with you all and some of the sponsors for this program, right? The health plans, the Wisconsin Hospital Association, right? So that everybody is on point with the same messaging, and then that messaging has clear action steps for folks.
Love that. Thank you, Bill. I want to go back to Becky real quick. There were some questions in the chat as well, and I had one on my list, just kind of thinking around, I think a broader piece, right? You see a lot of the marketplace, and you spoke around how we have programs in place to limit rate increases, which is great. But what are we kind of seeing right now for those rate filings for, program year 2026? What is that kind of in that bigger picture that we see for consumers? And how those, might even compare as you're starting to see those come in. And the question that was in the chat, I just want to highlight was, where did it go? We said there was some questions in the chat just on what that looks like across the broader industry as well.
So we are seeing pretty significant rate increases for the 2026 plan year. And what that causes is your healthy population will then, kind of step back and decide not to participate. Therefore, it's called adverse selection. So a larger percentage of the pool has higher needs. Therefore, the costlier, which will increase the cost of insurance going for the carrier. And so it's a bad position to be in. And I understand the point of view from insurance companies because they are going to have a higher cost population. Therefore, they need to increase.
Yeah, absolutely. I think that's, and I think you're starting to see, I will note one of the things that I've been tracking is even just, nationally, right? You see Centene, United Healthcare, all folks who are starting to say like, hey, we are taking back our revenue projections for the year because we think we're going to have a really major situation on our hands. And so, what are those kind of broader trends you're seeing in the insurance marketplace, Becky? And then also, are there, I'd love to hear, there's also, I think, subsequently, right? And I think even in Wisconsin, we're moving a little bit quicker on some of these things like direct primary care and things like that that have started to come out as like ways to cut costs both in the small group and marketplace sides, right? How do you see those intersecting as part of this marketplace challenge?
Yeah, so the disruptions we're seeing in the ACA marketplace and will probably leave the door open to other healthcare coverage arrangements like direct primary care arrangements and short-term limited duration health insurance plans. It's really important that consumers are well informed and understand the full scope and limitations of any coverage that they pay for, whether it's ACA compliant or a comprehensive healthcare or not. Consumers may consider other health insurance options that seem more affordable and accessible than comprehensive coverage on the marketplace. So we need to keep an eye out and make sure they're informed about what they're selecting.
Awesome. Thank you, Becky. I think back to Bill, I want to highlight what you said on SNAP here, because I think that is an important connection point, and something I've been thinking about on that end is, there is that connection point, right? But we have different requirements in terms of meeting that. We have different, exceptions. So, what does that look like in terms of opportunities to connect for ensuring continuous coverage? And, are there ways that we can, on the ground, help with, the state, connecting those systems, connecting, that kind of piece as we do SNAP and Medicaid enrollment or other things of that sort?
Yeah, one of the benefits in Wisconsin is we do have an integrated system. It's the same division. It's my same team that does both. And so we have the data in one system. That'll be certainly something we are working on over the next several months, is how much of that data matching we can do. We want to make the work requirements as easy on the member as possible. There are provisions in the federal bill that allow us to, you're familiar with ex parte, right? We can just, using our own data, know that they are meeting the work requirements. That is something we'll be working on over the next, again, several months. What the challenging part is, we don't have the clear guidance from CMS. I will tell you, as I'm part of the National Medicaid Directors Association, one of our biggest asks of CMS was to please talk to USDA and don't come up with totally different rules and requirements. They're two huge federal agencies who are not known to work really well together. So we do have some concerns that the federal regulations may not be aligned. We're going to do our best at the state level. We'll do our advocacy, but a lot of that won't be known until CMS comes out with clear Medicaid guidance.
Thank you, Bill. Yeah, I think, again, lots of opportunities for that connection with SNAP, and glad that, again, the state of Wisconsin has that at least connected, but hopefully the feds will get their stuff together to collaborate more on that one. I wanted to, it's, one of the pieces that really came through in the chat was focusing a little bit on, the immigration piece of that. And so wanted to maybe spend a minute, there were some notes in there around how that all ends up working. And so wanted to maybe spend a little bit, and that could be for both of you, kind of what you're seeing and what the kind of rules have started to come out regarding access for undocumented folks or other immigrants on both Medicaid and Marketplace, and kind of what the final guidance we've seen come out on that end has been.
I can address some of the news that's come out recently and the unfortunate situation of us having to change some of our language. So we still cover for emergency services. So it's a federal requirement. All states cover emergency services for undocumented individuals. We want people to get the healthcare they need. We are required to share all of our Medicaid claims information with CMS. That has been a long-standing process. As you know, Medicaid is a federal state partnership. It's 60% federally funded, 40% state funded in Wisconsin. We are required to share that data on a regular basis around our entire enrollment. What we can't guarantee is what CMS does with the data that we're required to share with them. You may have seen recently that the Attorney General has joined a multi-state lawsuit to stop the federal government from illegally sharing healthcare data or Medicaid data with other agencies. We'll have to stay tuned to the court case. That's the best information we can provide folks at this time, is that they are still eligible, but we are required to share that data with CMS, and we can't control what CMS does with it.
And anything on your end, Becky, on that?
No, nothing to add. Well,
Okay.
well said. And it is, CMS at times can be a black box. It's hard to get information that is useful for us so thank you, Bill.
Thank you. Yes, I'm just looking through my notes here. I know one of the things, and this is, could be for both of you as well, and figure out on that end. But there was one provision about, for patients that don't meet the work requirements, this is where the connection points started to be made, right, in the one OB3 or HR1, whatever you want to call it. But I know there was at some point there was some provision added in talking around, well, if you don't meet this for Marketplace or Medicaid, like then you can't enroll in the other program. And so curious if you might have any information on what ended up being passed on that end. Because I think that, if that was, finalized in that bill, right, that impacts, right, oh gosh, like now we really can't address the other side of this and get people on coverage in other aspects. And so curious on where that might have landed.
Yeah, I am going to have to take back, and quite honestly, if you were tracking the federal bill like I was in those last couple days, there was a lot of stuff that was in, and then it was out, and then it got put back in, and I actually would have to go back and double check where that language actually ended, because there were a lot of last minute changes. It's not something I'm currently tracking on, but whoever asked the question, I appreciate you asking that, and we will track that down and where that ended in the bill.
And I have no answers for that as well.
No worries. I know that honestly, I was feeling the same way. I was like, I don't remember what the actual language was where it ended up, because it was one of those things that kept coming back in and out. So no worries on that one. Wanted to go back a little bit. It sounds like there were some questions related to SNAP. And so wanted to maybe talk a little bit further on that real quick. Sorry, my computer decided it wanted to slow down real quick. Or actually wanted to talk a little bit about, it looked like there was some questions related to the Marketplace as well, regarding messages for assisters and what, oh my gosh.
Would you
Okay, there
like
we
me to
go.
read any of
I
the
am back. Sorry, Allison.
Yeah.
My computer decided to be goofy for a minute, right? It's a Monday morning still. I'm so sorry about that. And so for Becky, one of the questions was, do you have the ability to investigate misleading marketing of plans? And then also, will OCI consumer messaging for coverage year 26 include education on ways to assess those kind of cheaper coverage options? And so just two questions for you specific.
For the first question, absolutely. And I think I answered that. Is the best way, if you're finding misleading information that's in media or otherwise, to go through our complaint process that formalizes it and allows us to reach out and investigate it further. So please do so. And as for the other question, in ways to access cheaper coverage. So not necessarily ways to access cheaper coverage, but more so informing what is included in certain policies and whatnot. So our website has many guides and a ton of information in regards policies and the difference between them.
Great. Thank you, Becky. Appreciate you answering those. One of the questions in the chat was also related to changes to the access system and what that might end up looking like. And so there were some changes that I know, Bill, your department was thinking of making. And so what kind of are the status of those, and what does that kind of look like as we move forward?
Yeah, I saw the comment. There's what we affectionately call the pizza tracker, right? People are used to, you order your pizza and you want to know where the status is. When's it gonna be delivered? We are still moving forward with that so that folks can see that if they've submitted their Medicaid eligibility application, that it's been received and that it's being worked by a worker. And then if it's in a status where we've sent a letter and they need to provide additional documentation, we still plan to move forward with that. I know that is still on track. We think that'll be incredibly helpful. We know that we've gotten feedback from consumers. We also know that we get a lot of phone calls from folks in our IM agencies, both in Milwaukee and in the counties, with people calling to just check on the status of their application. So if we get the pizza tracker out and people can do self-service and know that their application is being worked, it actually allows us to have more folks processing cases and fewer folks answering phone calls. So we see that when we have a return on investment here, we think it's important, probably more than ever. We may have to make some adjustments with the new policy, but yes, we are moving forward with that access change.
And I think that, still goes into some additional questions just around, where can we as, community-based providers and navigators, where can we be, again, most helpful in these processes in terms of feedback, in terms of groups? And so I was just curious for both of you, I think, how can, as you continue to think around this, I feel like this is a time when we have to work together even more than ever before, right? And so both as a state agencies that, are two separate agencies thinking about two different things, how is the state thinking about collaboration on some of these areas? And then how, I know you have the DHS, healthcare coverage partnership as well through OCI. So thinking about that and how that continues to evolve in this moment. And then thinking about, again, how do we as partners continue to come together? I know, Billy, you talked around some of the unwinding groups. And so just, maybe filling in more on that piece again.
Well, I think from my perspective, you just landed it. We're putting a lot of attention to the DHS OCI healthcare coverage partnership to make sure we get the word out to have a game plan to, educate and make sure people understand the current situation. So a lot of time has been spent with that work group.
Thank you, Becky.
I think, and I just got a quick update that the pizza tracker, the benefit status tracker, goes live next month, October of 2025.
Yay.
So look forward to that coming soon. The other piece of unwinding that I failed to mention was we added a lot of data sharing during unwinding, especially with our health plans and other providers, right, who we can share PII or PHI with. So that they couldn't see which of their patients or which of their members have an eligibility date coming up soon, and remind folks, whether that's their insurance company or their doctor, and they can say, oh, Scott, I see your Medicaid eligibility is coming up in October. Do you have what you need? Can I help you connect you to somebody to make sure that you maintain your eligibility? We've maintained those data sharing tools since unwinding. If your organization isn't engaged, you can certainly go to Forward Health. We can do all the paperwork so that we can share that data. But we found that also helpful to just help alert other assisters to when somebody's renewal might be coming up.
That's great. I have maybe two final questions, I think, as we kind of wind down to this last 5 minutes here. And so wanted to, after all of the craziness of the federal level ended, and after all the state budget was finally passed, of course, we heard that our dear Governor Evers is no longer seeking a third term. And so by all means, you don't have to get into the full politics of that end, but as you all think around that, obviously politically appointed positions, you know, what does the next 15 months look like for your two departments? And if you had a golden wand, you know, what would you want to get done in that time frame as priorities, especially in this, you know, we're adding more uncertainty to an already uncertain time frame, right, Bill? I think around that 2027 time frame, and that's right when a new administration would be starting. And so would love to just, you know, hear from both of you what that might look like.
Yeah, I think Scott, you hit that right on the head. Obviously, the work requirement provisions are effective January 1st of 2027, and a new governor will take office in January of 2027. So what's important to me is that we set up the next administration for success in this space. There will be continuity. There are a lot of dedicated public servants and civil servants who've been through many transitions, who've worked on Medicaid for years. But it's about making the right policy decisions now in the 18 months that we have left to be as consumer friendly as possible, and to set up our system for success leading into 2027. Most of that will be well set ahead of time, right? The communication has to happen way before the policy goes into place. The system's going to be built way before 2027. So really my goal and success looking back will be that these new requirements go off without a hitch and people are able to easily maintain their benefits come 2027.
Great. Thank you, Bill. And what about you, Becky?
And I can echo, we're full steam ahead, and I really like how Bill put it. We have a department full of very technical, capable staff that will be consistent moving forward. You know, we are always actively pursuing various health policy and how to further the momentum to better define certain areas and whatnot. So we are continue to work at that, and we work along with the National Association of Insurance Commissioners to try to get consistency between the states, and various things are highlighted right now. So that work continues.
Great, thank you. And then a final question for both of you. We'll kind of this nice closeout is, you know, if you were in the shoes of an enrollment assistor, you know, an eligibility person at this moment, a navigator, heading into this open enrollment period, but then also, you know, the upcoming changes, you know, what are 2 or 3 things you would focus on most to help make sure they're best prepared?
Well, I can kick it off. And so really consider the full cost of coverage, including the premium, the deductible, the co-pays, etc. Very important. And also to be cautious about plans not sold on healthcare.gov and thoughtful about the limitations and benefits of other healthcare coverage arrangements.
Fantastic, Becky.
I'd say from a Medicaid perspective, going into this fall in particular is reminding folks that the Medicaid changes haven't taken effect yet. There's a lot of misinformation about that, and that the best thing they can do today this fall is make sure that their contact information is up to date, because information will be coming out throughout 2026. So I'd say those are the key takeaway messages to share with consumers. And then for you as assisters, make sure you're on our listservs, make sure you're checking out that website, because that's where, as the details of this policy come out, it will be posted so that you are all set for the next open enrollment period. And hopefully we'll see you in a year at the next conference, talking about the changes that'll be just around the corner.
Thank you, Bill. And what a fantastic way to kind of close us out with some helpful advice as this kind of opening plenary ends. Really just want to thank you both for your time today, and all of the work you all in your departments are doing to, you know, handle all of this madness that's happening right now and all of the competing different things that are happening. So just want to thank you both, and thank everyone that has showed up today. And I'll give it back to Allison as a move on to the next session.
Thank you so much. And I echo that. Thank you so much, Bill and Becky, and you as well, Scott. This was such excellent information. And yeah, we will close out this session. Thank you for your time. And we will take a 10-minute break here and be back at 9:50. Thank you all.